This is our patient, Woody. My name is Jenna Rhodes. I will be the nurse performing a head-to-toe assessment on him. So I'm going to have him confirm his name, his birthday, make sure it matches his hospital bracelet. Then I'm going to ask him 4 different questions to make sure he's orienting, ask him where he is, why he's here, what year it is generally, ask him again who he is, and then sometimes what the president is. And then we're going to get our vital signs on the patient, and then we're going to start with the head. You'll examine and make sure that there's no abnormalities of the skull, no abrasions, anything like that, pressure ulcers on the back of the head if the patient is immobile, check for lice, spotting, stuff like that. And then we're going to have them, and we're going to go ahead and start on the face. We would have them close the eyes and squeeze them tightly, smile, frown, puff out their cheeks, and then we're going to check for the hair again for skin breakdown. Then we'll do the temporal test, so we're going to check their temples, and we're just going to see what it feels like when they clench their teeth. Then we're going to check for resistance, so we would have them open their mouth and then close their mouth and then push against our hands with resistance. During that, we're also going to massage the different temporal pieces, as well as when we are, I'm sorry, I get nervous with videos, but we are going to feel for different crackling feelings when they're opening and closing the jaw, just to make sure there's no issues with the jaw and the masseter bone. And then we're going to start with the eyes. You take your pen light and you're going to, of course, check the pupils. And then you'd have them stare at a faraway object and make sure. And then this, of course, is the pupil size. That should be between 3 and 5. And then that's when we would shine the light in the eye. And then that would be after they focused on something far away to have the pupils dilate. And then we would want to see them both constrict the same. And then we're going to have them follow this up, down, this way, that way, and then across without moving their head. And then we are going to take the pen light and follow it to their nose without them moving their head, but just to see that their eyes follow it. And we're going to take their ear. We're going to check and make sure that there is nothing on the outside. We can see on the inside clearly. Pull, make sure there's nothing very tender on it. For an adult, for us to check the inside, you pull up and back. And then we would use the lens to look inside of it. You're going to check the mastoid process behind each ear and make sure that there are no issues with that. And then we would close this ear, whisper on this ear side and make sure he could hear out this ear, and then do the same on this side. Close this ear and make sure that was fine. For the nose, we would also, when doing the face, we would check for sinuses. So we do here, 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 and here. But for the nose, we want to ask and make sure that they're not having any issues with drainage. And then we want to ask them to occlude one side and breathe in and out to make sure there are no issues with occluding one side of the nose. Make sure you check for a deviated septum. And then you also want to ask them to smell. Obviously not something awful, but just something you can smell, like if you've got coffee, tea, soda, something along those lines, or anything simple like that. Simple smells that wouldn't cause a gag reflex. Then for lips, you're going to check the color and make sure that they are still hydrated enough to where it is creating saliva. You want to ask them to stick their tongue out and move it side to side. And then on the inside of the mouth, we want to check the soft palate, the hard palate, all their teeth, inside the cheeks, and the uvula, just to make sure that there are no ulcers or anything of that nature. You want to have them do the ah, just to make sure that the uvula is hanging correctly. And then you also want to try to do the gag reflex. On the neck, you want them to turn their neck side to side and then look up and down, and then you want them to shrug, and then you want to see if they can shrug against your resistance. And then we're going to palpate the trachea, so we're going to feel through here, and then we're going to work our way down from all the different pressure points until we get down here to the lymph nodes, and that's going to be on both sides. So we'll go here, 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 and then we'd be down to the lymph nodes, and that's on both sides. And then you want to check right up here, which it would be just slightly above the collarbone. Then we're going to do the radial artery, which is going to be right here. And then we want to check the capillary refill of the nail. So you would squeeze the nail as long as the color is coming back within 2 seconds. That should be fine. We're going to check the skin, make sure it returns, which is awesome on him. You want to check the brachial arteries. You want to squeeze the fingers, make sure the fingers movements are going good, make sure that they can move their hands, the joints look okay. You ask them to squeeze your fingers as hard as you can. You're going to have the hand under the elbow, make sure you don't feel any issues with the mobility of the joints, moving up and down. And then you're going to ask them to put their hands out in front of you and hold it for 10 seconds straight like this. Well, obviously apart, but just make sure that the air's in a drift. Because, for instance, if this one was this way and then this arm was still straight and then this one was up, that is a major sign of a stroke. And then we are going to do the chest and then the breathing to do the chest sounds. Give me 1 second. Let me put on my stethoscope. You always check in this format. Right here, right here, right here. And then you would use your bell to make sure there's no heart murmurs. And then after that, you would check the lungs. Always check over here as well. And then you want to do the same for the back. Start here. Here. Go to the second intercostal. And then for the stomach, we are going to ask them about when their last bowel movement was. We're going to ask them about how they're urinating. And then we're going to check the bowel sounds, which we'll use our stethoscope for as well, just to make sure they are normal. And then we're going to palpate, and that's going to start. We're going to start gently. And you always want to check for bowel sounds beforehand because these can trigger bowel sounds. You just want to start light. And then for people with smaller hands, it's easier to do the deep ones with 2 hands, just to really get it going. And you want to go around about 2 centimeters each time. And then you always want to check down here below the belly button. And down to the legs, you want to check for color. Make sure everyone's color is looking good. Check out the leg hair and stuff like that. You're going to have them, you're going to feel for the pulse behind the knee right here. And then up here, you're going to check out their tibias. You're going to check their feet. We're going to get a capillary refill in their toes as well. Always check the feet very closely with diabetics, just because, as most people know, they don't have the best feeling in their feet. You also want to check to make sure that the movement within the knee is fine. And that is it as far as a head-to-toe assessment goes. It's very hard to do it on this. Unfortunately, my 1-year-old will not sit still for me to do it though. And I know that I will get better once I practice it on a real person and get into my own routine with it. But for now, I'm just trying to memorize all the steps. Thank you.